In Uganda, healthcare workers are on the front lines every single day, facing some really big challenges. But what if they had a new kind of ally? We're talking about artificial intelligence. And in this explainer, we're going to explore how AI isn't replacing doctors, not at all. It's actually empowering them, helping to bridge the gap in care right where it's needed most. Okay, so when you hear AI in medicine, what pops into your head? Probably some kind of sci-fi robot, right? But the reality, especially in a place like Uganda, is so much more grounded. And honestly, it's way more inspiring. This is not a story about replacing people. It's about supporting them. It's about real doctors, real patients, and a technology that's just quietly working in the background to make their lives better. This question, this is really the heart of the whole thing, isn't it? In Uganda and, in a lot of places, healthcare systems are just stretched so thin. So how do you possibly serve a huge population when you have limited infrastructure? And maybe more importantly, how can technology step in and help without losing that essential human touch? So let's paint a picture of what this challenge actually looks like on the ground. It means, pretty simply, there are not enough doctors for the number of people who need care. And that creates this huge ripple effect. Long waiting times just become normal. And all those essential resources, well, they could spread incredibly thin. This is the daily reality that these healthcare professionals are working so hard to overcome. But here's the thing. It's in this exact environment, this really challenging environment, that a new kind of support is starting to make a real difference. Now, this isn't some magic bullet, okay? It's a practical tool. It's designed to assist, to support, and to empower the healthcare workers who are already there. And that tool is artificial intelligence. All right, let's be super clear about what AI is and what it isn't in this situation. It is not here to replace doctors. It's not making diagnoses all by itself. The reality is much more collaborative. You got to think of it as a support tool, like a diagnostic assistant that's helping a human expert. It's a powerful data analyst, crunching numbers in the background. So how does this actually help a busy nurse or a doctor? Well, it automates some of those really time-consuming tasks. Just imagine an AI that can quickly analyze complex medical data, or maybe flag potential signs of a disease so it can be caught early, or just keep medical records perfectly organized. All of this frees up precious, precious time for what really matters, caring for patients. The impact of this technology is probably most powerful in rural areas, places where a trip to see a specialist can be a really huge challenge. In these communities, even simple, accessible tools can have a massive effect on people's health. So let's actually look at a patient's journey to see how it all works. So the whole process is actually pretty straightforward. It all starts with a local health worker right there in the community using something like a tablet to collect patient data or maybe some medical images. Then that data is analyzed by an AI assistant, which might highlight something to look at. And this is the crucial part, the final step is not a command from a computer. It's decision support. It's giving insights back to the health worker to help them make the absolute best choice for their patient. And the support, it doesn't just stop at diagnostics. AI is also helping to make the whole system run smoother. Think about managing appointment schedules, or delivering really important health education to the community, or just making sure patient records are kept efficiently and securely. Each one of these things helps the clinic run better, which, again, frees up even more time for patient care. Okay, we absolutely have to pause here for a second because this is so important. No matter how advanced this technology gets, it is, and it always will be, just a tool. The intuition, the empathy, the critical judgment of a human doctor or a nurse, that's irreplaceable. You just can't code that stuff. So the whole point of AI here is to augment human expertise, never to replace it. Now, to use a tool this powerful, you have to have a strong ethical framework. That's just non-negotiable. We have to fiercely protect patient privacy. The technology has to be designed to support health professionals, not to undermine them. And every single application has to be guided by this unwavering commitment to responsible, ethical use. These are not just suggestions, they're absolute necessities. This quote just nails it. It perfectly captures the core message. AI is a phenomenal tool for improving efficiency. It can organize and analyze and streamline things in ways that are just incredible. But at the end of the day, it's that human connection, that compassionate care from a doctor or a nurse, that is what ultimately saves lives. So this leaves us with a really critical question. Knowing that it can support these overburdened systems and empower healthcare workers, but also knowing that we need that human oversight and strong ethics, should AI be used more widely in healthcare? It's a huge conversation that's really just beginning, and honestly, it's one that's going to shape the future of health for every single one of us.